common here. I hope I guess that. And Mr. Tope, for the privilege. Welcome everybody. I'm Dr. Agumedo Samuel. I'll be taking us through common health issues in women of reproductive age group, and just to like mark the just concluded World Women's Day. As we all know that women generally, they are very important in the society. They are the backbone of the society. And I think without them, I believe we will not have a functional society. So we need to support them, and we need to encourage our women. I will not take much of our time. I'll quickly talk about the topic that was given to me, which is common health issues in women of reproductive age group. By the way of introduction, okay, let me just put it in a PowerPoint. Okay, so that to be okay. International Women's Day came about due to several historical occurrences, and it's very symbolic combination of both the long public struggle of women's rights and the more private struggle that happened over the years. And it was first celebrated on the 19th of March 1911. Was later shifted to the date we are actually celebrating today, which is 8th of March. Women joined to celebrate the date that represents equality, justice, and peace and development. And the International Women's Day is rooted in the struggle of women seeking to participate on an equal footing with men. I will quickly go through this quote by Margaret Thatcher that says, in politics, if you want anything said, he said you should ask a man. But if you want anything done, you should ask a woman. And another one from Brian Young, which says you should educate, you educate a man, you educate a man. Yes. And when you educate a woman, you educate a generation. That one speaks a lot of God. So now I'll be talking about what are the health issues and challenges that that women have generally. And there are plenty, but I will just talk about the key points that actually affect the mental and the health of women. The first one I'll be talking about, I have them plenty. So the first one I'm talking about is I'll be talking about is female sexual dysfunction. It's a broad term. I actually did a study on this. That was some years back, and the study was done in Oshogo. So we did it in women of reproductive age group. So it's more than the word female sexual dysfunction. It's more peculiar to married women. Some people are married and they don't even know that there are some things that they need to do sexually. Maybe there are some things that is lacking. So, and they are just, some people just believe it's just like, okay, female sexual dysfunction. They might be having some symptoms and they don't really know that it's actually female sexual dysfunction. So it's a broad term. It's a term that encompasses like the sexual desire disorder. Some people don't have the sexual desire. The sexual pain disorder, when they have sex, their partner, they have pains. Then the sexual arousal disorder, they don't even feel like maybe when you touch them, you don't even feel anything. Then orgasmic disorder. Sometimes some people have they come on time. Some people have actually kind of get to reach orgasm on time. While some people, it all depends depending on body system. All these things can actually affect some people mentally. You might not know. some people are actually affected because when they actually did this study, then we found out that because we did it among married women. That was why what we did. We found out that within that metropolis, that's Oshogo and its environment, we discovered that we have majority of women that they have one or two components, and they are bothered in it, but they don't know how to go about it. Some were bothered, some were not. But I think they didn't really, maybe if they had actually had an opportunity to interact with the medical personnel, they should have told them, okay, what are the things to spice your sexual life? What are the things to do to get these things? What are the things to do to actually get a good life sexually? Because sexual life for married women is very important. So some people, their sexual life, it's not good, but they don't know, they can't say it out. Obviously, now when you tell a friend, this is what I'm experiencing, most especially when you are discussing with a non-medical practitioner, they tend to give you some false advice that we might not be able to be comfortable with. Then we actually talk about like, okay, confidentiality. When you have this, is am I if I tell this person, is he going to keep my secrets? So a lot of people decided to keep this thing to themselves, and it's affecting them. It's affecting their mental health. It's affecting their sexual life. It's affecting their relationship with their partners. So I think speaking out, meeting a medical personnel, it's not necessarily you can meet a mental health. We have a lot of people actually believe that when you say, okay, go and meet a mental health person, they believe it is when you are mad. No, it is not until you are mad that you actually meet a mental health. That's an average Nigerian for you. So when you meet a mental health person, they actually guide you. You meet a medical doctor, they actually guide you and tell you what to do about it. Then another one is the endometriosis, and sorry for using this. Okay, I will actually explain. I'll break it down. It's common, but some people tend to ignore it. Some people have these things, but they don't really know that they have it. They just believe that okay, some people might be having a painful menstrual cycle. They believe that this thing is painful. Maybe sometimes even initially it wasn't painful, but later it now became like started being painful, and it started being painful and continuous like that. So it's maybe your message that was initially not painful, decided that it's being painful. It is when we have the tissue that was supposed to be in the uterus, we have it elsewhere. So sometimes that's about that. All of a sudden, I used to have the normal flow before. All of a sudden, my flow started being increased. So even though there are a lot of things that can increase flow, but with pain, uh, it's endometriosis. These are the it's one of the commonest causes. When someone is having a painful menses, and at the same time is having increased flow. So and all of these things can actually also affect fertility in a way. Actually, it affect fertility. Some people don't like it. It's common menses that is painful. I don't worry. The next one I will take aspirin. I will take this. No, you take drugs. You need to come out, talk to a physician so that they can guide us about it, and they can also actually tell us what are the things to do about it. Then the second, these are the symptoms that I told you: cough, acidity, pain during intercourse, vaginal bleeding. It might be in between menses, since some people having irregular menses, then abdominal or heavy flow, get weak, and or some other funny symptoms. Then another one is the gynecological cancers. This thing is, we have a lot of gynecological cancer. We have the one that affects the breast, the one that affects the cervix, the one that affects the vagina, the one that affects the vulva. But I think the commonest cause now that we have presently, and it's on the rise, is the breast and the CA cervix of the cervix, and they all have they have predisposing factor, like just the strong factor that could actually predispose someone to having a breast cancer is family history. When you have a family history of breast cancer, you don't take it lightly. Like we all know Angelina Jolie had a very strong family history of breast cancer, and she decided to take out two of her breasts because he was like, let me just take it up since I have a strong family history. So fine, maybe okay. She decided to do that, but as a as women and maybe younger women, both adults, we need to pay attention to ourselves, pay attention to the rest. And then sometimes there was a time they were advocating. I think it has stopped now, maybe because they are now concentrating more on maybe the COVID factor and the HIV factor. Actually, like kind of diverted people's attention, maybe the medical world attention, away from all these cancers to uh, directed them from away from all these cancers. So that I think lately I've been seeing little awareness about this thing, and it's very important because self-breast examination we actually do when you have a lump. Okay, why is this lump there? You can actually go and see a doctor. They check. Once they check, okay, the lump, the location, then okay, what are we going to do to it? If the thing persists, sometimes they said, okay, let's take it out and send it for histology. But some people will get it wrong. Like once they take that long part, some people don't send it for histology. What they just do is that they they just keep it. They say, nothing. I'll go and pray about it. I'm not saying prayer will not work. I'm not saying it's prayer. At least when we pray at the same time, we do the right thing. You pray while you also do the right thing. You send it for histology. Then now the histology, if the result comes out to be something that is benign, then it's benign. If it comes out to something that is maybe that could pose maybe a future threat to the person, then we might need to kind of start a therapy so that it will combat the aftermath effect. Because by the time it starts spreading, it could lead to a lot of things. Because there was a time there was a time very long time ago when I was in medical school, I heard of a nurse that he had breast cancer. He was supposed to, being a nurse, was supposed to come out, but it was, I felt maybe, I don't know, maybe I was told that she was putting anointing oil. Later, she went somewhere on the breast that she was supposed to actually show someone like, okay, you have medical professionals around you. You are ignorance sometimes can make us to do some things. So she was putting anointing oil. At the end of the day, she started spreading, and she died. So, what are the risk factors? The risk factor, as I said earlier, for breast cancer is um, a very strong family history towards it. Then sometimes if someone all this exposure to some maybe all this radiation, sometimes smoking, alcohol in excess, understand, because medically sometimes they say there's a unit of alcohol that you can take, there's a unit of alcohol you can take that is smoking entirely, it's actually affects it. But I think the main thing is a family history. And once you have a doctor, and just need to just see a medical practitioner, and you advise them, because there was a time someone came to the hospital in Lagos, and I she confided in me. She told me, and I examined. I discovered that I was breast cancer. I told her, okay, they will need to take it out. So I invited a surgeon that actually okay to come and see her, and to just evaluate her. Then the second one is cervical cancer. It's also on the rise, and or the I think for an average women of reproductive age group, there's a test they normally do, which is HPV, human papilloma virus. You can do it. I think it's common everywhere. You can enter most of those facilities, even those government facilities. They can do it. Those ones will actually give a guide whether there is an abnormal form of cells in the cervix that is growing. They pick it early, and they actually do some things to it. That's why even when I'm seeing in medical practice, if you are seeing a lady of reproductive age group, it must be in your history, gynecology history. Are you aware of pap smear? Have you done it before? So if that person is not aware, what we normally do, because that was what they taught us in medical school. So you must ask, lady, women of reproductive age group, you have them, whether they are aware of past men. If they are not aware, we not cancel them. That's what we normally do. We not cancel, okay, this is what the past men will do, fix some things. However, because the common the risk factor to this is infection with human papillomavirus. That's why they are, once they check and they take vaccine for it. There's a vaccine for it. Most people do not know that there's a vaccine for it because it's actually one of the commonest cause of cervical cancer. Then multiple sexual partners, and untreated infections, maybe that has prolonged for long. Then another thing is HIV. In as much that we have a lot of people, a lot of programs. I actually have a friend of mine that's is presently in Nairobi. He's working with one of the NGO group, and what they are doing is they are giving drugs to people that are infected with HIV/AIDS. Now, some people don't believe that it actually exists. The last time I saw my friend, he was giving me just registering and he was giving me data, and the thing is actually on the rise. People I don't think the way they used to advertise HIV on the screen, on everything, has actually reduced drastically, where it is increasing. Like there was time I saw, I don't know whether you guys actually heard it. They said it's common in the Lekki, HIV is common everywhere. I don't know how they got their information, but what I can just say is it's very common. It's within us, it's around us. So for someone that, if you think maybe if you not see someone that is HIV positive, it's because most people that are HIV positive, they will not even come. They will not come out and say. There's some people that are actually taking medication. They will not come out and tell you that they are HIV positive until. But we health practitioners, we know again, because I can't count the number of people that have encountered that are HIV. People that you have to treat, and you don't even need to discriminate. I take samples from them. I protect myself. I take samples from them, I attend to them like normal, because you don't discriminate. So far that because this one is HIV, doesn't mean that you do not attend to them. Because you average, and so health practitioners, they know that this thing exists. This thing exists because there was a funny thing that happened when I was in medical school. So there was this lady I was supposed to clerk. So I was about clerking. One of my colleagues said, I should go and get another patient. I should clerk another patient. So when I was clerking another patient, the guy came back, they come and clerk this patient. He wants to go and clerk another patient. So man was like, I think this patient just tell me that he's no longer seeing this patient. Okay, wow, but I called him. He was a colleague, and I said, wow, he did not say anything. Later, that told me. And I said, HIV, whatever that is. I said that you shouldn't be discriminating. I said that he was not interested any longer. So the reason, what I'm trying to say, they are actually around us. The health practitioners, they know, because they come in for tests, and people that, if they are able to pick this thing early, you can live normal life without any problem. Once you take your drug, the viral load is low. You can marry. There's a way to deliver baby that will not even be HIV positive. Proper monitoring, the follow up, everything will just be smooth. It's just like someone that's having just a normal virus. It's just in the body. But when someone leaves it untreated for long, there is no follow up, then the effect will start coming in. They start fighting the immune system of the body. Then by that time, patient will start having end stage disease, multiple something, because immune system that are supposed to fight this infection, normal infection, they are no longer there. So it's very important that we should know that it's actually common, that we need to protect ourselves. We need to be careful of what we share with a stranger, with people that don't really know. Just like a general protection, because the way they normally tell us in medicine, they said you treat every patient as if there is danger, because you can never know the one that will put you in trouble. And that's the truth. So far that you now say, I can't say because I want to see a patient now. I said, please, I want to know, check whether you are HIV, because you know it's not like they said, treat every patient. So now what we just have to do is we have to be careful and be watchful of whatever we share with a random person, even a very close friend. Non-communicable disease. This thing that non-communicable disease there are a lot of it, but I'll just talk about the common ones that that are present and that people assume to be the disease of the elderly. But now it's no longer the disease of the elderly. It is now affecting the younger ones. So especially it's now affecting the younger ones. So that they need to know. It's the number one is one of it is hypertension. Hypertension is increasing. Like I've seen someone that was diagnosed uh, of hypertension at the age of 20. I think it was 20, was 28. Can you see? So I've seen someone that was diagnosed of yes, maybe even much younger. And this one, it's there are the things that you might not even know. Some people are actually hypertensive, and people that are an average person, a working class person that is that goes to work every day needs to check we need to check ourselves. We need to know our baseline blood pressure because you'll be surprised that when they start taking, you need to be checking it. Just maybe any weekend that you are free, just walk into any of the facilities around. Just tell them that please, can I check my blood pressure? It is very important. You know, sometimes me at work, sometimes I just enter one of the nurses and say, please, madam, please check my BP for me. It is as important as that because you cannot. Some people. That's why some people say I saw that man yesterday and he collapsed. He will say, it's people from his village. It's not people from his village. You don't know what, you don't even know that whether there was a high BP. Because I was saying there was a man that came to the hospital in Lagos, just walked in and was like, he's having a headache. He was having symptoms of headache. And by the time I checked, the BP was like 200 and something, 200, 170 something. It was like, before you know it, before you know it, it just give the one of the complications that will just take someone unaware is not stroke. Stroke can affect anybody. I've seen I've managed a 39-year-old man with stroke. And what happened was like it was in Lagos. He went to club normally. He didn't know that he was hypertensive. He drank heavily. So it was when he was dancing, he just fell. They felt it was hangover. They were putting water, they were pouring water. Until the money did not come, he started having one-sided weakness. That was when they came to the hospital. They brought him and they discovered that he was having stroke. So it could affect anybody. It does not. It's not irrespective. Before people used to have this notion that stroke affects elderly. No, about BP and its complication, because one of the complications of BP is also stroke and is the commonest of it. It affects elderly. No, now we need to check ourselves. It's affecting younger ones because I don't know, maybe because of the stress, because as you know, as as technology, as we are advancing, there are a lot of stress and that comes in. I know we need to cater for this, we need to attain this. Now that we are trying to achieve some things, we are trying to kind of like meet up with some things, we need to actually check ourselves. We need to check our BP. Another one is that is diabetes mellitus. It's also very common. Understand? It's also very common in the sense that you might be having normal body weakness that you don't even know you think that is malaria. Because what shocked me was like there was a young man when I was a young man who just walked into the hospital in Lagos. He just came in and he was like, yeah, doc, I'm weak. I've been treating typhoid and malaria at home. He came in with a nurse. So he now said that the nurse have been giving him drip at home. They have been giving him drip at home. That is just what he needs. That he needs strong antibiotics. That is his diet typhoid is very strong. So I said, okay. And me, when I see my patient, I think beyond typhoid and malaria because typhoid and malaria, yes, everything is not typhoid. Yeah, this was typhoid and malaria. I think because I see my patient from head to toe. So and I said, Olga, please can you come back? Let me. You said taking that. He was giving me some funny symptoms that he eats a lot. I was like, when he said he eats a lot, I kept that. That he pees a lot. How often do you pee? He said, sometimes I can wait, I can pee. I said, the reason why I pee a lot is, he told me that the reason why he peed a lot was that because he was taking water, a lot of water. I said, okay, Oga, I know you used to take water, but you also peed a lot. So what I will just do for you is like, please, can we do something? Can you just let me take that your let me just take sample? The guy said he was not going to do it. And I said, me, I cannot say I want to start doing you for what I don't. I can, I can decide to like, okay, let me admit, let me put you something and give you maybe it's money you want to pay. You know the way all these guys used to, all these young guys used to do. I can decide to put you somewhere and be giving you whatever you want, but just do this urine analysis. The other told the nurse, she did it. She came with the result. I saw glucose in the urine. I was like, wow. How old was it? He was 27. So I said, wow. And I said, okay, please, and another one, you do blood sugar. I said, I'm not going to do blood sugar. I did the blood sugar. It was high. That was when we know that. I told her, this thing that is doing you, it's not typhoid, it's not malaria. You are having symptoms of DM. So what are we going to do to you? And I said, oh, okay. Is the guy was in a denial. I was like, no, can't be me. And I said, Oga, calm down. We just have to let me just explain what is happening to you. I explained to Again, I said, out of like, okay, I said, okay, curiosity. And I said, I should do something. So I started from therapy. Believe me, after 2 days, it got better. And I told him that so far that you are better does not mean you should. Now, like you need to be coming for follow-up. If you know you can't come, you can go to a nearby hospital. I can write a letter for you so that you can just continue follow up because it just left. So what I'm trying to say is that it is very close to us. The symptoms this guy was having was like I said was weak over time. And so I was able to pick that because I interacted with him and I was able to get the information. So all these things and what are the things that 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 predispose people into all these things. All this. That's why carbonated drinks, too much of these carbonated drinks, alcohol, smoking, and it's also like tied to. It has a very strong background, like family history of hypertension and diabetes. A very strong background because it runs like the medical world, family history first. Because when you are saying what are the risk factors for hypertension and diabetes, aside all this smoking lifestyle modification and the rest, obesity, the taking of alcohol, tobacco use, family history is very important. Everybody has a family history. Everybody has a family history, yes. You now pay attention to your diet, pay attention to your lifestyle. So another one is polycystic ovarian syndrome. This one
Hello,
is
doctor. Hello, doctor.
hello.
Sorry. Can you please show your video just for recording sake?
Okay. So another one is sorry, I'm trying to. So another one is
Thank you.
polycystic ovarian syndrome. So and what this one is it's a diagnosis that maybe sometimes they might not even it might not be give you classical symptoms of 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 the syndrome itself. So it's one of the commonest causes of infertility that you just come across maybe when someone is having irregular period, when maybe a female is having male facial pattern and maybe when hair pattern rather is having maybe hair growth all over. Those are the things we need to check the hormone. We need to check this. We need to check the hormones. There are a lot of other things that we just check hormonal profile from there to give us a clue whether it is polycystic ovarian syndrome, and it's not something that presents classically like that. So it's one of the it's part of the it could cause infertility, which is at least which is on the rise now because people have been saying, okay, infertility is very common, and this is also part of one of the common causes of infertility. So another one is uterine fibroid. There's this thing. Uterine fibroid is it's a growth in the within the uterine cavity, and it's very common in blacks. That's what it is, very common in blacks, and sometimes it's non-asymptomatic. You can see people having symptoms of breast. That's why they say, some people will say, if you have fibroid, they will give you one thing that will melt it. And you need to seek a medical practitioner. Let them examine you. Let them know what to do so that if it's symptomatic, symptomatic fibroid could be someone can have it and have irregular menses, painful menstruation, and sometimes you can see people bleeding for long. It could give that kind of symptoms. But sometimes it will not be, it will not give any symptoms. Just to see a woman, I've seen a pregnant woman that delivered without, and it was even when we were doing, it was during the study we discovered that he had a fibroid. So it's as simple as that, and sometimes it could be funny that will give some fun symptoms, that symptoms like miscarriage, that people might not be able, like and symptoms like miscarriage and pregnancy problems. So that's that about uterine fibroid. So I think there are a lot of things, like I say, those that they said they normally sell. And I think I've heard about it. They said if you take it, to melt it, to do this. Even when you do surgery, even the doctors will tell you that there's still probability for it to regrow. That's just about uterine fibroid. There's another thing is interstitial cystitis. That's the infection of the bladder, which is very common, because and it's commoner in women because they have a very short urethra. That is where the urine normally passes. So it is very easy, especially when there is infection in the vagina, very easy to migrate and give swollen symptoms. You see people telling that I'm having maybe low abdominal pain, I pee frequently, I pee. You don't, when you have all these kind of symptoms, you have to talk out. You meet it's commoner in pregnancy. It's very common in pregnancy. And when you have these kind of symptoms, you talk out to meet a medical practitioner so that they can actually advise you and tell you what to do. I think I've managed this thing when I've managed this thing in one patient like that in Lagos. Another one is excess body weight, and excess body weight is it's something that it's commoner generally, you understand, but I think it's more common in women. And women tend to get weight, because most sometimes they're like, okay, they just feel relaxed. Maybe they believe that some people actually believe that when you exercise, it's actually for men. It's not actually for men, no. It's for both gender. And you try to kind of anything that causes that you think that okay, you are gaining weight, what is making you to gain weight, you pay attention to it. There is a weight, you can give a target for it, you understand. And if you are very much more concerned about it, there are some things you can do to actually reduce this weight. There are some exercises that you do. There are some people that they are experts in that. I think we've seen results all around. So if you are on the bigger side, there is a way to normally do. You can do your BMI, and they normally say your weight and height ratio. That you can do your BMI. If it's the normal, ideally it should be around 18.5 to 24.5. So if somebody is more than 25, it's high. It is overweight. They call it overweight. But when it's more than, let me 30, is obese. So we can actually do that to now measure. Okay, am I overweight? Am I okay? Am I normal? What are the things to do? You can do diet. Diet helps a lot. It helps a lot in doing that. And so another one is some people. So yeah, this complaint actually do come out from women generally. You see people that said that I need to add weight, or I need to add fat where fat is necessary. Understand? Like I'm too slim, and the now ended. Some people end up taking some drugs like steroids, which is very bad. That can even have predispose them to having this hypertension, diabetes, renal failure. There are a lot of kidney failures around that we know even. So what are the things causing it? Maybe mostly these are the things that are caused by creams and creams, all these organic creams that they don't like. You have to go simple as much as possible, because God has made everything very simple. I used to tell people to look to be healthy is not expensive. It's just because if you just want to start having all this unhealthy lifestyle. That's when you now start having expensive. When you see all these things that are expensive, now I'm not running anybody's business. As I say, they sell burger somewhere, is expensive. I had someone selling burger 15K. You understand? So where you can just carry down your 15K and just go out to buy fruit from this people that sells fruit. You take fruit, you take pure things. I used to tell that my sister is an advocate of fresh. I told them I something fresh. When you are even, I told my parents, if you want anything, just go to the market, buy whatever fruit you want to buy. You can buy them a lot. You can buy fruit, orange, pineapple. Buy them, you take it. It's actually good. So when person is actually like kind of complain that okay, maybe I'm lean, I need to add weight, and there's a weight that you even gain that you not even like it. Don't use weight gaining medication. It is not good. And some people are actually like in the fact like they say they want to go and do maybe fat deposition and the rest. It, the aftermath effect is very bad. If you actually want to gain weight, there are a lot of things to do. What are things to do? You eat healthy, then you relax. What are the things? Are you having adequate relaxation? Is it like maybe after work now you still have to okay? I still want to go and see my friend. Are you having enough rest? That's what we should ask ourselves. So and sometimes it might be maybe your nature. God, it might be your nature to just be to be like that. But at the same time, if you want to like actually gain weight, you reduce your the weight at which the rate at which you stress yourself. That's what you try to relax, try to rest more. Like now, if I want to add a very serious weight, anytime I'm on leave like this, I just try to lock myself at home, and you see me, I'll just be at home eating, go out, come back. I will not this stressful, whatever. By the time I bring my leave, you've added weight. That's it. By the time I start work now, work stress and the rest, that starts leaning down. Then this thing is very important. Another one is infection. Infection is very important. It's very common. It's very common. Very common. That's what I'm saying. It's very common. It's very common among young women, even married people, married women. I've seen married women coming out and saying he's having infection. I said, if you're having infection, you need to come with your husband because you are going to put of you together. So I'm not trying to scatter that, but it was just like a plain truth because sometimes you might feel that our partners maybe they're actually loyal to us, and you don't know that they are not loyal. You don't know what they do outside. So that's why I tell you if you're sexually active and you're having infection, I'll tell you that you need to come with your partner or you'll be using protection. It's very common because at the long run, it predisposes to infertility, blockage of fallopian tubes, ectopic pregnancy, miscarriage, and a lot of things. And just because of one common infection. And this gonorrhea, women does not show symptoms for gonorrhea. It is women that show symptoms for gonorrhea. That's why you now see men, you now see some guys, maybe the guy is in the bedroom and he's peeing. Maybe he might not want to hear, he might not want you to know that he's having a painful relation. You now be like kind of singing, maybe playing music. You get what I'm saying? So it's women are asymptomatic. Chlamydia, men are asymptomatic. Why women are symptomatic? Chlamydia infection, when women does it, sometimes see them having discharge or responding discharge. Also, if not properly treated, it could ascend and now cause pelvic inflammatory disease, which is very difficult. If you miss it, to treat will be very difficult. I know someone that is battling with this, and it has been very difficult. He just met me recently, and I told her what to do, and I told her to just get back to me anytime. Maybe anytime he's having symptoms, I think it's no longer having symptoms because we need to seek experts. We don't need to just go. I'm having this. Just go to a chemist. They'll just give you medication and they say go and take it. I remember when a lady came to me, the lab scientist, he told me that he was having a discharge, and I told him like, okay, madam, he said he has done a lot of tests because she's a lab scientist and she did a lot of tests. She went to a pharmacist. They gave her some medication. I said, okay, you've done tests now. They give you medication. It's not good. And I said, well, let me just see your results. She showed me that result. I said, I'll place you on some medications. And I said, doctor, is not like I said, don't worry, but you take it for some period of time. Like, and you have to be doing some things. What are the things you do that could predispose to having infection, even if you are not having a unprotected sex? Some people are in the habit of douching. The problem are having like our private part, our private part protect itself. Uh, the way they normally say, the vagina, it's a very clean environment. It's very clean. But the moment, because there should be a balance between, but when we start washing our private parts with soap, with all this organic soap, they said that they are key, maybe that stop infection that they sell around, then you are killing the normal virus, the normal flora that is supposed to protect you. Like me now, like some people are fond of bathing with antiseptic soap for long. Like me, antiseptic soap are not meant. You just use it for a while. Even I've seen the medical personnel that is fond of that. Like me, I use more of toilet soap. I don't use it because if I only use all this Dettol when I maybe after some time just like only days be long, or maybe if I go to the hospital, because hospital environment, you don't know. I work in an hospital environment, so you meet a lot of people. I just get back home, maybe I'll just bathe on real occasion. I don't use it for long. The one I bought last, I just bought it for 1 month. I use it and it's finished. I might not even use it in the next 6 months. I use normal toilet soap. I don't have all this skin, whatever, even though I'm not that fresh. but I think I'm okay. The essence of it is like our body, there's a way the Lord designed it. There are some things we should not do. We should not wash our private part with soap. We should not wash with all these. I want to wash something. Let me just wash. We should not take antibiotics anyhow, because sometimes if you need it, you might not be able to now get result for it. So, as I was saying, the lady, she either placed her on that medication and he left. She left rather. So after some time, I didn't even see her. So later she now came. Then I said, she now came. I said, can't you remember me? I said, I forgot you, madam. I said, well, that's how the drug is said. Maybe you told me that you not work. And I said, because he had been taking drugs and has not been working. I said, but this one work for you. That's it. So we need to pay attention to all these things, because especially infection. I used to tell infection, we need to pay attention to it. If so, anybody that is sexually, I used to tell people that are sexually active, use protection, because you don't know, you don't trust. Don't like say, hey, my partner, the time I asked one girl, like, okay, you have a boyfriend, I have a boyfriend. How sure are you that your boyfriend is not? I said, no, I'm not sure. I said, at least if you are not sure, you can still use protection. We need to protect ourselves. And even in protection, if a husband and I've seen husband and wife, I have to them, they are going to be on it together. I cancel them separately because I don't want to cause issue. I cancel them separately what they need to do, what they need to do privately, so that it will not be